Human body is extremely sensitive to infections. Any pathogen can invade the body tissues anytime, beyond a human's control, and its multiplication can result in a serious infection owing to the toxins it produces. Your immune system usually works to fight any germs, be it bacteria, viruses, fungi, or parasites, and to prevent infections. If an infection does occur, your immune system will try to fight it, although you may need help with medications such as antibiotics, antivirals, antifungals, and antiparasitics. However, for reasons researchers don't understand, sometimes the immune system stops fighting the invaders and begins to turn on itself. This is the start of sepsis. Today in this video, we will be talking about this gamut of infections that often proves to be detrimental to human life in depth. In layman terms, sepsis is basically the body's overreaction to an infection. It is a life-threatening medical situation. It is one of the main healthcare problems at a global level. Though the level of mortality has considerably decreased during the last decade, this problem still bothers many people. Sepsis occurs when an existing infection sets off a chain reaction throughout your body. It is caused by infections that begin in the lungs, urinary tract, skin, or gastrointestinal system. If not treated promptly, it can cause tissue damage, organ failure, and even death. Just like strokes or heart attacks, sepsis is a medical emergency that requires rapid diagnosis and treatment, or else it can lead to severe sepsis and septic shock. Just to be clear, sepsis is not contagious in itself. You can't spread sepsis to other people. However, an infection can lead to sepsis and you can spread some infections to other people. So what leads to sepsis? Bacterial infections are one of the most common causes of sepsis. Fungal, parasitic, and viral infections are also potential sepsis causes. You can get sepsis when an infection triggers a chain reaction throughout your body, causing organ dysfunction. The infection leading to sepsis can start in many different parts of the body. Sepsis causes fever, a rapid heart rate, and difficulty breathing, among other symptoms. Sepsis is a global health crisis. As per global statistics, it affects between 47 and 50 million people every year, and at least 11 million die, which is approximately one death every 2.8 seconds. Depending on the country, mortality varies between 50 and more than 50%. Many surviving patients suffer from the consequences of sepsis for the rest of their lives. Now let us move on to the stages of sepsis. There are 3 stages of sepsis. First is sepsis, which we have been talking about. It is an infection that gets into your bloodstream and causes inflammation in your body. Then comes severe sepsis, basically when the infection and inflammation is severe enough to start affecting organ functions. The third is septic shock. This is a severe complication of sepsis that causes a significant drop in blood pressure. This can lead to many serious complications, including organ dysfunction, respiratory or heart failure, stroke, and even possible death. While sepsis often occurs in hospital settings, it can also happen in other locations. In some cases, you might not even know you have an infection that could potentially lead to sepsis. Sepsis can advance very quickly to severe sepsis and septic shock. As it transitions, it becomes more life-threatening. Some symptoms can overlap, like severe difficulty breathing, acute confusion, and bluish skin. Another key symptom of septic shock is very low blood pressure. Although some people have a higher risk of infection, anyone can get sepsis. People who are at the highest risk include the young children and seniors, people with weaker immune systems, including people with HIV or those undergoing chemotherapy treatment for cancer, people in ICUs, as well as people exposed to invasive devices like intravenous catheters or breathing tubes. However, healthcare has improved over time, and so have the sepsis outcomes, at least in nations with modern ICU facilities, most likely as a result of improved general clinic practices and the application of sepsis treatment guidelines. Sepsis is predicted to be a significant clinical concern in the future owing to a combination of variables such as aging population, aggressive therapy for chronic illness, particularly cancer, and developing antibiotic resistance. Until a cure for sepsis is found, early detection and treatment is essential for survival and limiting disability for survivors. So, although the goal is far, it is attainable. This was all you needed to know about the human body's overreaction to an infection, which is commonly referred to as sepsis. If you found the information useful, do let us know in the comment section below. Thank you for watching.